So it's screwed. So once it's screwed in, it's fixed. And usually you can put it at the edge of the bed for patients who have focal injury, and it really helps them to function on their own without waiting for somebody to pull them out. Now, if we say this is our bed rails on this edge, and then there is another bed rail on the other edge, if Suleiman is going to stand up, all he needs to do is this hand, opposite hand, will reach across the bed rails. Try to reach. Good. And then if we teach Suleiman, we have all of this big. So the problem we don't have is, but the whole idea is each Suleiman hold it at the edge of this, and then try to bend his leg. If we teach Suleiman to bend his leg from this position, Suleiman can pull the bed rails, even if he doesn't have enough strong movement. You can pull the bed rail into this direction without us supporting it, and then from this direction, you can use the bed rail to sit at the job using this bed. And if they have bed rails on both sides, as a rehabilitation, I always encourage the patient to, like bed exercises, word exercises. When we are leaving the patient, we ask them just roll it, hold it, and then he turns halfway, and he holds himself to maybe count of 10 or 5, and then turn, hold himself to the count of 5. So I usually encourage patients to be turning side by side. It's very important for their bed mobility. You have them move from side to side to enable them to form. So even in the wards, if there are no bed levers rather, they may have bed rails. You can think of using the bed rails whenever you go in for the nurses. If they can use their hands, just ask them, hold the bed rails and then pull to one side. The only trick is bend the leg opposite, and then they push here and they are pulling here. If they cannot push here, you can support them here, and then they pull to one side. And then they do whatever they do and they move to the opposite side. For physios, you can do them as bed exercises for them to be holding themselves as much as they can. Some of our patients, for them to roll even it's a hard work. And if you ask them to hold in that direction, they can't go forward. So that's the training you can give them. Just rolling gradually. That will build in their trunk, muscles, and the sitting balance that we are talking about. And it's one of the things that they can do to help in the sitting balance.